Brian Hooker, our Chief Science Officer. Brian.
Thank you so much. There have never been the opportunities that lie ahead of us right now. I mean, we're absolutely thrilled in CHD Science for what we can do and what we haven't been able to do since I started this journey about 25 years ago. Having Mr. Kennedy at the helm of HHS means that there is a new era of openness in terms of being able to analyze the data. And these databases, you know, people don't know about the CDC's Vaccine Safety Data Link, but actually your pocketbook does know, because you have spent $50 million, not you personally, but $50 million of taxpayer money goes to support the Vaccine Safety Data Link, and has done so since 1990. And that is a compilation of 10 million patient records from 10 million patients, including 2 million children. I had the opportunity, I was one of 3 scientists that had the opportunity to very quickly and get into the Vaccine Safety Data Link when I first started this journey, well, actually a little bit later in about 2011, 2012. We published the information. We showed that mercury is a neurotoxin. Imagine that. We showed that when you get mercury to your child, they get neurotoxic effects and neurodevelopmental disorders. The CDC didn't like that, so they summarily kicked us out of the Vaccine Safety Data Link, and the Vaccine Safety Data Link has been essentially closed to the public ever since then. So our job now is to make sure that that information is now open, so we can open the coffers and we can actually look at what I estimate at least 10,000 unvaccinated children in that database alone. When we look at the healthy unvaccinated, we see something that's unprecedented. We see something that society hasn't seen for many, many, many years, probably never seen whatsoever, given some of the other modern medical advances that have come forward along with the vaccine era. But the health is absolutely amazing. And we've done this in small scale databases. We've been scrappy. We have what's called the Clinical Informatics Program, where we have participating doctors who let us, after their electronic medical records are de-identified, we aggregate this information, and we've been able to aggregate upwards to 90,000 children in this particular database. We are in the process of publishing off of the Clinical Informatics Program, and we are doing another Vax study that should be out probably by May, June of this year. So we're very, very excited about that. We've also been invited by the state of Louisiana, get this, to be able to look at infant death records, infants from age 2 and under, and look at their death records as well as their vaccination records. And right now we're haggling over some demographic data to see if there's any connection from a time standpoint, from a number of vaccine standpoints, with these unfortunate families that have experienced infant demise. Studies have shown that infants that die of SIDS, typically SIDS cases, 75% of all SIDS cases happen within 1 week of vaccination. 50% of all SIDS cases happen within 2 days of vaccination. So we do see from other data and other information as correlations, but it's because of the freedom, it's because of Mr. Kennedy, and it's because of the years of dedication to people at Children's Health Defense and the supporters of Children's Health Defense that we have an era of openness in the state of Louisiana would even consider letting Children's Health Defense be able to look at their vaccine records, and this will be peer-reviewed. We're working with individuals from Tulane University that will actually be our peer reviewers for this information, and we're very, very excited about that. Let's talk about COVID really quick before I wrap up. The incidence of cancers since the COVID era, not since COVID hit the shores of the United States, but since the COVID vaccine was introduced, the incidence of terminal cancers has increased dramatically. In some instances showing upwards to a twofold increase in cancers. This is based on DMED, which is the Department of Defense Medical Epidemiological Database. In the military complex, they're seeing cancers literally double. In that, we are working with a company called Medicinal Genomics, and we're actually getting tumor tissue of individuals that, both living and dead, that had unfortunately contracted cancer after either a COVID shot, 2 COVID shots, or COVID shots and multiple boosters. Our initial findings are showing that we do see different elements because of the work of Kevin McKernan at Medicinal Genomics. We know that the Pfizer vaccine was contaminated with an element called SV40. And you know what? When we look at these tumors, not only do we see SV40, but we see the precise sequence of SV40 that was found in the Pfizer vial. And so something is up here. Something is going wrong here. And I am blessed and fortunate to be part of the team that is elucidating that is looking for that. We're soliciting, because of donations, we're not doing 1 tumor or 2 tumors. We have the capability of doing upwards to 50 different samples from 50 different tumors of turbocancers after the COVID-19 vaccine. And it's the type of dedication of our donors and supporters that allow us to do this vital type of research. When I entered into this space, there was a huge vacuum. There was a huge hole. There were individuals staring me at the face saying that vaccines don't cause autism, when I had a child that was vaccine injured and autistic in my own house, and there was no data to support it. There was literally a void. But with Children's Health Defense and with the opportunities, we're able to fill that void, and we're able to fill that void with independent science that's devoid of pharmaceutical entanglements. And I am so thankful. It is wonderful to be a part of CHD, and probably more wonderful in this era than any other time. Thank you so much.